Hi everyone, Aaron Brooks with Perfect Postures, and today I want to talk about low back pain. Most times people come in and they have a diagnosis. For example, there may be a bulging disc, or there may be some stenosis, which is like a narrowing of the canal, or there might just be a muscle sprain or strain. The one thing I want to talk about is that we all pretty much for the most part drive or we sit. One of the things that I think is important to note with driving is foot position, and I'm going to get into a little more detail on that. Now, when I tell you this, I'm not telling you to completely change the way you drive with your foot, because that would be dangerous. If you're used to driving a certain way, of course, then do that. But I just want to kind of make a note here and show you how important it is in regarding how your hip directly affects your pelvis, which then directly affects your low back. And if many of you watch the videos, we're always trying to figure out how one part directly affects another part. So we're not about symptomatic treatment. We don't treat the area. We address mechanical causes for a particular diagnosis. So back to the driving. So I'm going to use an example. I'm going to just show that when my right foot turns out, and I'm not sure if I'm even in the full screen here, but let's say my right foot turns out, and that's pretty common when you're driving. Right foot turns out, working the gas pedal there. When your foot turns out, especially if someone has excessive foot turnout, what it does to your hip is it causes your hip to rotate outward. It's pretty obvious, right? It's called external rotation. What's not so obvious is what it does to the tilt in your pelvis. And this is really important because we deal so much with pelvic dysfunction. So, right foot turns out. What that's going to do is allow your pelvis to kind of tuck under. Now, if you want to do a little experiment, because you're not quite clear, if you pigeon toe your feet and you lock your legs straight, your pelvis is going to tilt. It's going to tilt this way, so your butt's kind of sticking up in the air. If you toe your both feet out, your pelvis is going to tuck under. So when you're driving, it's the same thing. Right foot turns out, pelvis is going to tuck under. Now, how does that directly influence the low back? Well, if your pelvis tilts under on your right side, what's going to do is going to actually elongate or open up the right side of the vertebrae. So now that's going to change the pressure and also the tonicity or the tautness of the muscles and fascia on one side when you compare them to the other side. So just something to think about. Again, wouldn't tell you to completely change it, but there's certain people that drive with their feet like completely turn out like this, and that is impacting their low back. So again, be careful. If you want to make an adjustment, that's fine. You're probably going to, if you're watching this when you're next time you drive, you're definitely going to be more aware of that. I'm going to show you a corrective exercise, and it's going to be how to address an asymmetrical tilt. You wouldn't really know that unless you had a diagnosis from another healthcare practitioner, but we're just going to base that on what I just discussed with the foot turning out. If you have any questions or comments, please feel free to post them on our site, and we'll see you next week.